Hi everyone, welcome to my presentation. Now we can discuss MCQ on bed making. Okay, here you can see the first question. In which strength Savlon will be used to carbonize cot and matters during bed making procedure? Option A 1:40, 2 1:50, 1:20 to 1:40, 1:30 to 1:40, and 1:40 to 1:60. The correct answer is option C 1:30 to 1:40. It is the ratio. So commonly we can use during to carbolize cot and matters during bed making procedure. Then here here 1:33. Here you can see 1:33 aqueous solution means 33 ml have to pour in 1 liter of water. So after that we have to carbolize the cot and matter. Then next one, not only that, it is also used for the treatment of wounds and burns, swabbing in ophthalmics. The next one, here also you can see the chemical name for Savlon is chlorhexidine gluconate. Next question. Which of the following action has to be avoided to prevent contamination of the environment during bed making? Strip all linens at the same time, embrace solid linen, fanning solid linen, finishes both sides at the same time. The answer is C. Fanning solid linen we have to avoid, and the use of following this step is we can prevent contamination of environment by this linen. Then next question, the bed which contains extra firm mattress with overhead frame is called cardiac bed, fracture bed, Fowler's bed, and operation bed. The answer is fracture bed. So fracture bed contains extra firm mattress with overhead frame. Then next, which type of bed should be kept ready for receiving a new patient? Which type of bed should be kept ready for receiving new patient? Open bed, admission bed, closed bed, or post-operative bed? The answer is closed bed. Then, in which of the following type of bed the top covers are pulled up to the head of the bed over the bottom covers and a pillow is placed on the top of linen or is covered with the bed spread? Option A, open bed, closed bed, admission bed, post-operative bed. And the answer is B, closed bed. Closed bed is a type of bed where top covers are pulled up to the head of the bed or the bottom covers and pillow is placed on the top of linen. And not only that, or it is covered with the bedspread. Then next question, a nurse had done the one side of bed while doing bed making. The nurse had done the one side of the bed while doing bed making. She is planned to turn the patient towards her side and move away to make other side. Before moving, she should raise the head and cover the patient's head with a blanket, raise the foot and raise the side rails. And the correct answer is option D. So when you are moving patient on the bed, compulsory you have to keep the side rails in order to remove the falls. Here you can see side rails are. The purpose of keeping side rails is side rails helps to prevent the patient from accidentally rolling out of the bed and injuring themselves. Then next question, what should a nurse do if she witnessed an occupied bed that's solid and looks wet? What should a nurse do if she witnessed an occupied bed that's solid and looks wet? Use hot water to clean the bed. Bed should be fumigated. Wipe the moisture with a disinfectant and dry thoroughly, and change the bedsheet with the waterproof mattress. The answer is See, wipe the moisture with disinfect and dry thoroughly. If the nurse witnessed an occupied bed that's solid or looked wet. So this is about the MCQ on bed making. Thank you all. Sorry, you have next question also. Before going to make an unoccupied bed, the nurse should primarily ensure which of the following things for an ideal bed making. Before going to make an unoccupied bed, the nurse should primarily make sure which of the following things for an ideal bed making. Use sterile gloves, keep laundry bag near the bed, call bell should keep near to the nurse, keep the bed at comfortable working height. And answer is D. So this is the primary responsibility of nurse, keeping the bed at a comfortable height. Then a nurse is preparing a bed for a post-surgical patient who had undergone surgery over abdominal region. So during this scenario, the nurse should place the waterproof pad on which part of bed? Over the top sheet, place over the bottom sheet, just over the mattress. Avoid waterproof pad for this patient. The answer is B. Place over the bottom sheet. Then next step. The nurse who is making the bed should avoid which of the following action to prevent environmental contamination and or uniform for contamination. Use the bare hand to prepare bed, having fan and AC to function, shaking the linen to wipe off the dust, keeping the windows open. Answer is shaking the linen to wipe off dust. Then the nurse should follow which of the following precautions while changing solid bed linen to prevent the risk of microorganism transmission. Do hand hygiene and wear clean glove. Roll all the solid linens outside the bottom sheet. Fresh linen should be placed over the foot end of the bed. Hold the solid linen away from uniform and place it onto the floor. The answer is do hand hygiene and wear clean glove. So this is the step. This is a precaution. The nurse can prevent the risk of microorganism transmission. So this is all about the MCQ of bed making. Thank you.